Alright, you guys, welcome back to the Joy of Gay Sex series. And once again, if you have not checked out my other topics that I have right here on my channel, go back and check out those topics. It might be something that you're definitely interested in hearing about. This applies to straight and gay folk, lesbians, everyone. It's not just for the gay world. This also happens in other, you know what I mean. So, yeah. So now we're going to talk about viral STDs. Unlike bacteria, a virus cannot reproduce by itself. It must invade a living cell to multiply. When a virus enters your body, generally through a break or pore opening in your skin, it moves in quickly. Your immune system creates T cells to attack it, but men with compromised immune systems may not be able to produce enough T cells to kill the virus. Therefore, AIDS patients may be either more susceptible to viral infections and or suffer more serious illness. Hepatitis. This serious liver disease is widespread in the gay community. It is communicated in many ways: by kissing, by contact with any of the mucous membranes, by eating infected shellfish, by rimming, by infected semen introduced orally or anally, and all through transfusions of infected blood. There are several types of hepatitis infectious, now called type A, serum type B, and type C, which is similar to type B. Systematically, they are all similar. Type B is the one that is spread sexually, but they are all highly contagious. If you have hepatitis, you must be careful not to infect other household members. No kissing of any kind. Keep separate dishes and wash them thoroughly. Since hepatitis is transmitted by feces, you should wash your hands after each bowel movement. The virus infects the liver. The early symptoms resemble the flu: severe muscle aches and pains, fatigue, fever, nausea, and at times vomiting. Sometimes a rash breaks out as well. Soon those symptoms disappear and you become extremely fatigued. Your urine turns monogamy brown and your shit becomes gray-white. Smokers lose their taste for cigarettes. Nausea and nearly complete loss of appetite occur. Then your eyeballs and skin turn yellow. This is called jaundice. By this time, the worst is over, although you certainly won't look or feel your best. You may even have trouble getting out of bed. Hepatitis A is generally spread by feces that enter your mouth either through rimming someone or through food you eat if a partner preparer or a food preparer hasn't washed his hands properly after crafting. Shellfish can pick up the virus in contaminated water. Salads are a common transmitter if washed in contaminated water. The incubation period is 2 to 6 weeks, and during this time you are infectious. The disease runs its course by 2 months, and your liver generally recovers completely. But alcoholics' worst liver may already be damaged, may have a more difficult time with the disease, and cirrhosis may occur. Hepatitis types B and C are similar. Type B is often called the gay hepatitis because it is often contracted while tricking, particularly in gay men who are fond of rimming. The incubation period for types B and C is 3 weeks to 90 days. Hepatitis B and C can be lethal in HIV patients. Statistics also show that 90% of AIDS patients who contract hepatitis will become chronic sufferers. There is no cure for hepatitis, just supportive treatment. You may seek a doctor's care. He will probably suggest plenty of rest, eating a bland diet rich in vitamins, and during the acute stage, eliminating all fat. Otherwise, you've become nauseated. He may also want to give you a shot of gamma globulin as a booster. Cut out liquor and recreational drugs for at least 6 months after you gain your health, or you'll have a relapse, which may be worse than your original disease. Don't make the mistake of thinking that you are cured of the disease when your eye color returns to normal. Take a multivitamin daily. In the past, complete bed rest was recommended during the acute stage, but evidence now suggests that moderate exercise is preferable. Discuss this with your physician first. Don't go to the gym without his permission. You will not be able to work for weeks, and during this period you will sleep more hours than you're awake. Only in exceptionary severe cases is there a reason to be hospitalized. Home care is normally adequate. Your lover, roommate, or friends will have to run errands for you. Don't be a hero. Ask for help. There is now an effective vaccine for hepatitis A and B, but not for C. If you are sexually active, get the vaccination. Don't pull it off, or don't put it off. You can get hepatitis more than once, and a relapse is possible. It is a very serious disease. So scary, you guys. So now herpes. Herpes infections are caused by the same virus that causes cold sores. Its source is the herpes zoster virus, which causes the childhood disease chickenpox and the adult disease known as shingles. In sexually active gay men, herpes generally appears in the form of small, clear sores usually seen on the penis, especially just under the foreskin, though they may show up anywhere on the body, including the face. Herpes simplex can be transmitted only during sex. Blowjobs, rimming, or merely rubbing your cock against a trick's ass can transmit it. The incubation period is from 2 to 20 days, although some cases are as symptomatic for as long as 4 years. The herpes virus invades the skin and the burning sensation occurs within a week. A couple of days later, you notice a cluster of small blisters. You're highly contagious at this point. If you touch the blisters, wash your hands because you can spread it to other parts of your body. Afterward, the virus enters a lengthened phase in which it goes into hiding, remaining dormant until it is triggered again. Once herpes go away, it can come back again suddenly. Subsequent outbreaks are completely unpredictable. There are no cure for herpes. There are treatments based on the drug Zofrolax that can reduce its effect or shorten the time of the outbreak. Don't have sex while you have these sores, even with a condom, because the condom may not cover all the sores. You may be inclined to have sex anyway because the sores often make fucking painful. AIDS makes herpes a more serious disease. Kaposi's sarcoma may be caused by a herpes virus called HHV8. I can read this one more section. Venereal warts. Venereal warts are caused by the human papillomavirus, HPV, transmitted during sex. It's as common as herpes, and like it, can reoccur. It's estimated that half of HIV-negative men and almost all HIV-positive men carry it. A partner fucking without a condom or simply rubbing his cock against your ass can transmit it. Dildos and other toys can carry the virus. You can develop a venereal wart on your asshole, ass cheeks, penis, and scrotum, the whole pubic area. Your hands are likely to carry the virus from one part of your body to another, although you will not develop symptoms on your hands themselves. Warts are not usually painful, but they can become irritated and make fucking uncomfortable. Appearing as clusters of small, rough granules, they can easily be seen and felt, especially on your asshole or perineum, the skin between your asshole and your balls. They are clusters of small, rough growths. If they are inside your ass, you'll feel pain, itching, and bleeding after crapping or getting fucked. The incubation period for venereal warts varies from 1 month to many months. If you and a regular lover or partner both have warts, do not resume sex until you both have been cured, or the contagious nature of the warts will lead to continued reinfecting. Lasers are now used to treat warts. That's crazy. Alright, you guys. On to the next video. I'm going to finish up this STD section, so stay tuned, you guys.